Hello everyone, how are you today? I'm Dr. Paramjeet and you're watching Dr. Education. Welcome to my channel. As you know, I make videos about health and healthcare topics, and today we are going to discuss about dry skin. If you have dry skin, what should be your self-care routine? Now, as you know, all my videos are directly referenced from the internationally accepted US National Library of Medicine, and this information is also taken from there, and this information will give you all the knowledge which you need to take care of your dry skin problem. So let's start.
अगर आप भी हेल्थ के बारे में जानना चाहते हैं तो सब्सक्राइब करिए मेरा ये चैनल डॉक्टर एजुकेशन और बेल का आइकन दबाइए ताकि आप आने वाले हर वीडियो का नोटिफिकेशन सबसे पहले पाएं।
Dry skin actually occurs when your skin loses too much water or oil. Dry skin is very common and can affect anyone at any age. So, how do you know that you have dry skin? You will have scaling, flaking, or peeling of the skin. If that is so, especially in winters, you have dry skin. If the skin that feels rough is also dry, skin tightness, especially after bathing, after taking a bath, shower, is an indication of dry skin. Then itching is very commonly seen with dry skin. Cracks in the skin that may even bleed are seen in dry skin. So you can get dry skin anywhere on the body. If you have these symptoms in limited part of your body, this can happen that something is causing skin drying in that area. So you can get dry skin anywhere on the body, but it is commonly seen on the hands, feet, arms and lower legs. So what are the causes? Dry skin can be caused by cold, dry winter air. This dry winter air can actually cause dry skin. Now, why will that happen? Because cold temperature causes the superficial blood vessels in your arm, in your skin, to actually contract, and therefore blood and therefore nourishment and therefore water cannot actually reach your skin, so your skin becomes dry in some time. Now you can also have dry skin because of hot or dry air in desert environment, because in that hot environment, or if there is a furnace, that heat is there in the air which actually removes moisture. So because of all these things, moisture can actually evaporate through the skin, and whatever water is coming in the skin is getting evaporated, so skin becomes dry. So in cold and winter, the skin is not even getting water, so that's why it's dry, and in hot the water gets evaporated, so it's dry. In air conditions that cool the air also remove the moisture. So moisture in the air is removed, and so is some moisture getting removed from your skin. So that all causes thing. Even taking baths, long hot showers or hot baths can actually remove moisture, does remove moisture, and if you do it frequently, you will have dry skin. Even washing your hands very often just by water also can have dry skin. And soaps, many soaps and detergents, especially hard soaps, hard rough soap bars and detergent soaps have alkali in them, and this alkali can actually strip off moisture from your skin. Then there are certain skin conditions like eczema, like psoriasis, atopic dermatitis, any dermatitis can actually strip your skin of moisture and cause dryness. This will be localized dryness. Then certain medicines, like some medicines which you apply on the skin, some oral medicines can actually give this side effect all over the body. Then aging is very common cause. as you age, your skin becomes thinner and thinner, and it produces less amount of natural oils. That's why drying is very commonly seen in elderlies. So what can you do? So obviously, as always, if you have a problem or a disease, you have to find out, pinpoint what is causing the problem and take care of that. So if you find out the cause, if any of these things are present in your life and you control them, then you can take care of dry skin. So what is the home care? What is the self-care which you can do? You can very easily take care of your dry skin and restore moisture to your skin by doing these things. What? You can moisturize your skin with an ointment, with a cream, with a lotion 2 to 3 times a day, or as often it is needed, right? At least 2 to 3 times. Then these moisturizers help lock the moisture in the skin, so they work best on damp skin. So after you bath, pat dry the skin. Don't rub off all the water from your skin, just pat dry the skin and then apply the moisturizer on a little bit of moist skin, because they can actually lock in the moisture. Now, avoid skincare products and soap that contain alcohol, fragrances, dyes and other chemicals, because these products can actually again cause dryness. Take short, and if you are taking warm baths, take them in for a very short time, or a very short warm shower. Limit your shower time from 5 to 10 minutes. That's it. Avoid taking hot baths. Warm is okay, lukewarm is okay, cold is fine, hot is bad for your dry skin. Hot baths or showers, hot towels are bad. Sauna is bad for your skin. Dry skin, I mean. If you have oily skin, it's good. So if you have a dry skin, bath only once a day. Then instead of using soap, try using a gentle skin cleanser or a liquid soap. Liquid soap, especially if it has added moisturizers. You can use any type of soap. Try a few products so that you know what feels best on your skin. Avoid scrubbing your skin. Scrubbing will again take off the moisture. If you have dry skin, shaving should be done right after bathing, when hairs are soft, right? So clothing is also important. Wear soft, comfortable clothing next to that dry area, or if you are completely dry, then wear soft, comfortable clothes. Avoid rough fabrics like wool. Wash clothes with detergents that are free of fragrances or dyes. Then drink a lot of water. A lot of water. I have made another video of how much water do you need in a day. It is not a fixed number, it depends. It has variables. It is not a fixed number. It has a lot of factors and variables. To watch that. Then ease itchy skin by applying a cool compress to irritated areas. So cold compression, cold sponging, what you can say, is good if you actually have itching. Then you can try over the counter medicines, creams, lotions if your skin is inflamed. Then look for moisturizers that contain ceramides. Ceramides are good if you have dry skin. So these are all the things which you should do to actually avoid or treat your dry skin instead of eating something. Water is the most important thing here. Not any vitamin or any multivitamin alone will work if you don't take care of all these things. So vitamins and multivitamins, taking a lot of fruits, vegetables are always important for any part of your body. So that should be done. Now, when should you go to a doctor? Now, call your doctor if you feel itchy without a visible rash. if dryness and itching keeps you from sleeping, if you have open cuts or sores because of scratching, if all these tips do not relieve your dryness and itching, then there might be a disease which is causing all your skin to get dry. There might be some side effects because of some medicine, something which you are taking. Even Ayurvedic, allopathic products or natural products can have side effects. Watch my video for that. I have a video for that. So guys, this is all about taking care of your dry skin. Now, same way you can take care of your oily skin in something like an opposite way. Oily skin is a result of when the sebaceous oil glands in your body produces large amount of oils. So this basically depends upon your genes and your hormones. They play a key role whether or not you will have an oily skin or not. Diet probably has a very little, if anything, to do with this, whether or not you are oily, you have oily skin. So the most important thing you can do for oily skin is to keep your skin clean repeatedly using warm water and soap, or a soapless cleanser. You can do that, or cleanse your face. You should cleanse your face with astringent or toner. You may also cleanse your face with an astringent pads if frequent face washes are causing irritation. Make sure to use only water-based or oil-free cosmetic products if you have an oily skin. And whatever I said about the dry skin, use everything opposite if you have oily skin. Simple. And do remember, oily skin are prone to acne. So if you have oils on your skin, you might even have acne. So same thing goes for acne people. They can follow this routine to certain extents. See, everybody has a variable degree of dryness or oiliness in the skin. Nobody will be okay if there is 0 to 10 grades of dryness. Nobody will be exactly on 10. You have to understand one thing, everybody's skin will be little different. Now if there is a 0 called a neutral skin and there is 10 plus 10 which is the most oily skin and minus 10 which is the most dry skin, you might, if you have a dry skin, you might be -1 to -9, you might fall somewhere here. And if you have oily skin, you might be +1 to plus something. So nobody is same. So there is no fixed number that how many times you have to do this, how many times you have to do that. For that, you have to be under supervision of a dermatologist if you want supervised care. But as a general rule, all these tips will help you out. So that's all about dry and oily skin care. So do share this video with everyone you know, and make sure to subscribe our channel Dr. Education, as well as my FAQ channel Dr. Education FAQs, frequently asked question, where I answer your frequently asked questions in short videos. Do check them out as well. Those who don't know me, I am a consultant physician and cardiologist in Yashoda Super Speciality Hospital, Nehru Nagar, Delhi NCR, and this is my channel. So till next time, stay connected, stay healthy.